For your NCLEX review, let's look at fluids and electrolytes.
Again, so easy ways to memorize fluid and electrolytes. So the objective, we want to understand how fluid balance and electrolytes affect the body, and then you should be able to spot abnormal signs very fast and know the safe nursing actions. Remember that if you can spot the imbalance, then you can save your patient. So it's very important. So note these basics, that 60% of the body is made up of water, and there are two major compartments. We have intracellular, that is inside the cell, extracellular, which is outside the cell. So do not forget this rule, that water will follow sodium. Okay, so water is more like a follower. Wherever sodium would go, water flows. So remember that if we're able to balance sodium, then we will be able to balance fluid as well. So in some of the case presentations, you may find cases of dehydration, which means that there is a fluid volume deficit. Cases of dehydration. So how will you be able to spot these cases with so much ease? How will you be able to spot these cases with so much ease? You have a case of vomiting, a case of diarrhea, hemorrhage, burns, a client who has been on diuretics. So you should be looking out for dehydration. So what signs and symptoms would tell you that, oh, this client is dehydrated? The mucosa, dry mucosa. You try to stretch the skin, there's poor skin tegel, low blood pressure, the pulses are so weak and thready, and the heart rate is increasing. And in cases where the client is like very dehydrated, realize that the urine has now become concentrated, and then sodium and hematocrit will increase. So how will we manage dehydration? So we manage dehydration based on the level of the dehydration, whether it's mild, moderate, or severe. So sometimes just allowing the client to take in a lot of oral fluids would solve it. But based on the level, we may have to give IV fluids, okay? So remember that. And whenever we are treating clients with dehydration, we would have to monitor the weight and then the input and the output. So remember this for dehydration, that skin will be dry, the blood pressure will be reduced, that is hypotension, and then the urine will be concentrated. So that's what I have here as yellow urine. So we're using the mnemonic DRY to remember it, okay? Do not forget this. Then we can have fluid overload. So when you see any of these cases in a question, think around fluid overload. A case of heart failure, renal failure, a client who has been given excess IV fluids. So what will you be looking for? What signs and symptoms will you be looking for? Edema, crackle, dyspnea, client is finding it difficult to breathe. And then bounding pulses, the blood pressure would increase, hematocrit will decrease, sodium, because you have a lot of water, so sodium will be diluted, so sodium will be low. And then client, if you're supposed to weigh the client because there's so much fluid, the weight would be high, okay? So how would we treat overload? There's so much fluid, so we have to restrict fluid and sodium. So understand the basics so that based on how the question is put, you can think through and be able to pick the right answer. And also, we want to help get rid of the fluid by giving diuretics, okay? We elevate the head of the bed, especially in clients with all of these signs of respiratory distress. So remember, there's fluid overload, so full veins, so bounding pulses, the lungs are wet. That's why when we listen, we have all the crackles at the lung bases, and then there's so much fluid kept within, so the urine output will be reduced. Blood pressure will be high, and then there will be dyspnea, okay? So do not forget, we used this acronym, so FLUID, fluid. So we're now diving into electrolytes. I want it to be very easy And we'll be looking at sodium, potassium, calcium, magnesium, chloride, phosphate. So for sodium is kind of easy to remember. So you have the 35, you have the 45. So 35, 45 sodium. So you know that sodium is 135 to 145. So sodium 35, 45. So 145 to 135 to 145. Okay. Then potassium. Potassium, there's this interesting memory trick that, okay, if I want to make banana bread, I need about 3.5 to 5 bananas. Oh, I have some bananas here. Yeah. So 3.5 to 5 bananas to make banana bread. So you're going to put that in your head. Okay, I love banana bread. Whenever I do banana bread, I 3.5 to 5 bananas. So the range for potassium, 3.5 to 5.1. So based on the reference you are using, so it can also even be around 5.5. So always look out for the reference that you are using. It can be 3.5 to 5.1. In some resources, you can see 3.5 to 5.5. Okay, so always remember this. I'm going to use 3.5, 3.5 to 5 bananas to make my banana bread. And yes, you will remember potassium. Calcium, the memory trick here is call 911. Call 911. So anytime I see calcium, hey, calcium, I'm going to call 911. So 9 to 11. So the 911 is 9 to 11. So 8.5. So you know that it's around 9 to 11. So it's going to be 8.5 to 10.5. That is the reference range for calcium. I've just rounded it up in the 911. But when you remember that, it helps you to at least remember that it's around this range. So 8.5 to 10.5. 911. I'm going to call 911 for calcium. Calcium is in trouble. So let's look at magnesium. Magnesium is kind of interesting, but hey, you remember it. 1.4 to 2.1 milliequivalent per liter. So for magnesium, this is the memory trick that I came with, that, okay, magnesium it starts with Mag. So, okay, when I see magnesium, I remember magnifying glasses. So when I'm using magnifying glasses, okay, it looks like it magnifies stuff to like 1.5 to 2.5 times bigger, okay? So magnifying glasses, magnifying 1.5 to 2.5. Yeah, you can remember a bit around that. And then you try and remember this, that yes, it's 1.4, so 1.5 to 2.5. So it's within this, so 1.4 to 2.1. At least it will help you to pick up cases where the client has high magnesium or low magnesium. So remember, magnifying glasses, magnifying items, 1.5 to 2.5 times bigger, okay? So let's look at chloride. Chloride, let's try, remember 95 to 108. I'll try to see I can get some memory trick for that. And then phosphate, 2.5 to 4.5. So phosphate more like, we started with 2.5, we added 2, and then we have 4.5. So I hope it's sounding a bit easier for you right now. Let's dive into it further. It will get easier. And magnesium too, I still found another word which says that when you remember Mag, you remember little Maggie, like a girl called Margaret, and she is 1.3 to 2.1 years old. This one is it's not that easy to remember, but if it works for you, fine. I have a girl called little Maggie. She's 1.3 to 2.1 years old. This is not so easy to remember, but I hope it helps. And then little Maggie loves bananas, and she ate 3.5 to 5 bananas. So you give that to potassium. And then little Maggie drank 9 to 10.5 ounces of milk. So I give that to calcium. And then she took a nap. And the nap was 135 to 145 minutes nap. After swimming in the ocean, you know that the sea would have sodium. So this is like, oh, I have a little Maggie rhyme. Little Maggie is 1.3 to 2.3 years old. She ate 3.5 to 5 bananas. and drank 90. It's a bit, yeah, it's a bit cumbersome. So whichever one works for you, the first one or this, pick it. And the main aim is that it should help you to be able to answer your questions. So let's dive into the individual electrolytes. But has it been good and exciting so far? Let me have your feedback. The feedback helps me, means a lot to me. So I know that whatever I'm teaching is helping, giving the feedback. Okay, so you're live on Facebook as well. So let's look at sodium. So we've already looked at the reference range, 135 to 145. So when you see sodium, remember, sodium is a follower, a water follower. Wherever water goes, sodium follows. And the main role is to balance water and also for nerve and then muscle function. So based on this function, so it's not about cramming it, it's about understanding. So if you know that this is the function, then if we have less of sodium, which is hyponatremia, that is the term, which means it is less than 135, the lower limit here. So how will this client present? How will this client present? Present with confusion, seizure, and then coma. Okay, so what will be some of the causes? SIADH, and then water intoxication. So water intoxication is causing hyponatremia. So if you have to fix this, what are you going to do? It means that the person has a lot of fluid, and so we have to restrict fluid because the sodium is low. Okay, so restrict fluid, and then we give hypertonic saline to help balance up the sodium if it is severe hyponatremia. Okay, we have hypernatremia, meaning it is high, more than 145. So client is thirsty, so water deficit. So client is thirsty, client has dry mouth, and then there is confusion. So this will be in cases of dehydration when you are losing water. So now you have too much sodium. Okay, so how will we fix it? We have too much sodium, so we have to give hypotonic fluids and then restrict sodium. We can't add on sodium. So it's about understanding so that you can think through and be able to get the right answer. So remember this, that for dehydration, clients can come in with the skin tegor, poor, there's agitation, there's low-grade fever, and then thirst. We see all of this when clients have hypernatremia. So remember, another important electrolyte is potassium. Potassium. Anytime you see potassium, remember the heart keeper. Potassium keeps the heart. Okay, so the main role is to help with the heart rhythm and then muscle contraction. So looking at the range, so 3.5, so less than 3.5 will be low potassium, which is hypokalemia. So the pulses will be weak, and since it's a heart keeper, the muscle will be cramping, there will be this rhythmless, abnormal heart rhythm. And when there is low potassium, the bowel sounds are reduced because the muscles of the gut will also be contracted. Potassium works on the muscle, so it will cause decreased bowel sounds whenever we have hypokalemia. Okay, so how will we fix it? Low potassium. So we can give potassium supplement. We can give potassium supplement. And remember, we never push the IV potassium. We never give it bolus because it's going to have issues on the heart. So we never do that. And anytime someone is on potassium, the heart keeper, we have to monitor ECG. ECG, you have to monitor the heart. So let's look at hyperkalemia, high potassium. The muscle will be weak, there will be bradycardia, the heart rate will be reduced. And when we look at the ECG, the classical sign you're going to see or pick up will be the peaked T waves. The T waves will be peaking, okay? So you would be tested on all of these. So look out for hyperkalemia and hypokalemia and how it appears on ECG. I didn't bring an image today, so look out for it. So how do we fix high potassium? We will give insulin, okay? Insulin will shift the potassium, and then we add glucose, and calcium gluconate is helpful, and then higher xylate. So always remember these. Whenever you see hypokalemia, have these on your fingertips. And we know that heart's equal to potassium, okay? Potassium controls the cardiac rhythm. Let's look at calcium. Calcium. So remember, calcium is call 911. So call 911. So 9 to 11, 8.5 to 10.5. Calcium is the muscle builder and then bone builder. So it's more around bones, muscle contraction, and it also helps with clotting. So whenever there is low calcium, think of tetany, muscle twitching. And then we have the positive Schuster and then the Trudeau signs. So anytime you see hypocalcemia anywhere, you know you are sure that you're going to see all of these to pick up the Schuster's and the Trudeau signs. So you can search it right now and then you see images of how the signs are checked, okay? The spasms and all of that, you can see that, and it helps to stay. So how will we fix hypocalcemia? IV calcium gluconate and then vitamin D. Let's look at hypercalcemia. When it's at the upper limit, more than 10.5. Client is lethargic, there's constipation, and then if you have a lot of calcium, it can now form stones in the kidney, okay? So how do we fix it? We have to give a lot of hydration. So hydrate, and then loop diuretics are also helpful. So remember how it will present: convulsions, there's arrhythmia, there is tetany, and then we have the spasm. So that's when you do the Schuster's and Trudeau, and those signs will be positive. So search it and look at the image and it will stick. You really get to know how we test for those signs, okay? And what a positive sign means. So let's look at magnesium. Magnesium is the muscle relaxer. When you see magnesium, just say muscle relaxer, and then when you go through the question, you're looking for stuff around muscle relaxation. So the main role is muscle relaxation. It has effects on the heart and the nerves. So if you do not have enough magnesium, that is hypomagnesemia, you're having some tremors, there's hyperreflexia, and then the heart rate is increased. So magnesium is low. If I want to fix it, magnesium sulfate. And then we monitor the reflexes because the low magnesium is causing high hyperreflexes, okay? So let's look at high magnesium. Your magnesium is just too much. There will be bradycardia, reduced heart rate, then hypotension. And remember, if it's low, we have hyperreflexia. So if it's too much, we have decreased reflexes, okay? And then respiratory depression. So when you remember magnesium, remember the muscle relaxer, and you use that to go around that question on magnesium. So if you have too much magnesium, then stop it. Stop the magnesium. Give calcium gluconate, okay? Give calcium gluconate. Awesome. Let's look at chloride, another interesting one. Remember that chloride follows sodium, okay? So it helps maintain osmotic pressure and acid-base balance. So NCLEX loves to text you around that you should know that chloride follows sodium. So chloride works with sodium to maintain osmotic pressure. So whenever we have hypokalemia, it's going to follow hyponatremia. It follows sodium, so hyponatremia. So when the sodium is being lost, the chloride is being lost. So clients with low sodium will also have low chloride, okay? So that client will be weak and will have shallow breathing. What about high chloride? High chloride. Client who is dehydrated. So the client has lost a lot of water and has retained sodium chloride. So that's why the client will have hyperchloremia. So clients will have increased breathing and then will be lethargic. So this is the key here. Do not retreat in your questions. Anytime we see hypochloremia, we always correct the sodium first because they move together. So when you correct the sodium, the chloride is also going to balance, okay? So always correct sodium first. Do not fall for this trick, okay? Remember. Let's look at phosphate. So phosphate is more of energy. So phosphate gives energy and is helpful with bone strength and then acid-base balance. So if a client has low potassium, so phosphate is more of energy. So the client will be weak. There'll be low reflexes. Clients will be confused. Okay. And if there's high phosphate, we usually will see that in renal failure when the phosphate is retained. Clients will have tingling and then signs of tetany. So remember this, calcium and phosphate will move in opposite directions. So anytime you see calcium and phosphate, remember the tug of war. So when calcium is increasing, phosphate will decrease. If phosphate is increasing, calcium will decrease. So they are in that kind of tug of war relationship, indirect relationship. So do not forget this. So I'm summing it up here to make it simple. Sodium, water follows salt. So wherever water goes, sodium will follow. And then potassium, the cardiac keeper. So the heart, it works on the heart, okay? Cardiac rhythm keeper. Calcium, bones, working on the bones and helping with clotting. Magnesium, remember, the muscle relaxer. Phosphate, energy. Phosphate is energy, so it gives power to the cells. So that's why you can deduce in that question that hypophosphatemia, the client will come with weakness. And then chloride, remember we say that it goes with sodium. So anytime we are correcting, there's hypochloremia. When we correct the sodium, the chloride too will pick up. So this should help you to be able to recall, look out for the ECG signs, how hypokalemia will look like on ECG, and how hyperkalemia, hypomagnesemia. So look out for all of that so that you will not get confused. And always think safety first. Anytime there's anything around cardiac, neuro, or respiratory changes, you have to prioritize that. And then we have to always reassess the labs. If you're supposed to give electrolyte replacement, you did the labs and that was their range. Before we replace, we have to make sure we reassess before giving the replacement. And if NCLEX asks, like, which clients are you going to see first? Which clients are you going to prioritize? And you have one with potassium and calcium abnormalities, pick those one first. You have to prioritize that because that one can kill the client very fast. Okay, so this is there's few slides coming up are very important because you can be tested on these, especially in your select all that apply questions. You would see some food nutrients, and then you're supposed to deduce the kind of electrolyte that food nutrient contains, so that if a client has hyperkalemia and you are being asked, select all that apply, which of these foods should be avoided or which of these foods can the client take. So you know that as hyperkalemia, you're not going to choose bananas because bananas are high in potassium. So let's look at them, take notes so that you will be able to answer those questions. So potassium-rich foods, and search for more examples, okay? There are lots of examples. Bananas, oranges, orange juice, avocados, they are all high in potassium. So the clue here to help you ace questions around this will be that give these to clients on diuretics. You're going to take yes, because diuretic clients may be losing potassium. So give the client potassium-rich foods. And then DKA, diabetic ketoacidosis. And then avoid in client with renal failure or on spironolactone. Spironolactone is a potassium-sparing diuretic. So as the client is taking spironolactone, the potassium will be kept in the cells. So there will be high potassium. So you have to avoid giving stuff that will increase the client's potassium. Okay, and then let's look at sodium. So sodium, most of the canned foods and stuff contain a lot of sodium. So canned soups, broth, veggies, processed meat, ham, bacon, sausages, cheese, pickles, olives. There are a lot of examples. Search for more so that you'll be able to answer questions around these food nutrients. And the clue here is that restrict sodium in clients with heart failure, hypertension, and cirrhosis, okay? Because wherever sodium will go, water will go. So if that client has fluid overload, heart failure, hypertension, you would want to restrict sodium. And then encourage sodium in hyponatremia. So if client already has low sodium, then we can give sodium containing foods, and also in additives, okay? Also, let's look at calcium. Calcium rich foods, milk, yogurt, cheese. My baby is crying. Today she's not in a good mood. I don't know if you can hear her crying upstairs. So we have milk, we have yogurt, we have cheese, and always want us to feel her presence in the class. So sardines, canned salmon with bones, they all have a lot of calcium. So when will you pick that? So if client has osteoporosis, has hypocalcemia, if it's a postmenopausal woman, they need calcium, okay? And then avoid high calcium foods in renal failure or hypercalcemia. There's already a lot of calcium. We do not give, okay, calcium-rich foods. And always pair calcium with vitamin D. It helps with the absorption rate. So let's look at magnesium-rich foods. These are all high yield. Please make sure you revise them so that immediately you see, select all that apply, you see all the food ingredients and you get so confused. Which one contains magnesium? Which one? No, that should not be your portion. Master these, okay? So magnesium-rich foods increase magnesium. Dark leafy greens, so spinach, kale, nuts like almonds, cashew, peanuts, very important. So for these clues, watch them. Replace magnesium in alcohol withdrawal clients with malnutrition. Do not get tricked. We have to replace magnesium, okay? And then we restrict magnesium in renal failure or magnesium toxicity. So let's look at phosphorus. We're finishing up. So phosphorus-rich foods, milk, cheese, yogurt. Milk, cheese, yogurt, meat, poultry, fish, nuts, seeds, and beans, okay? So for the clues, we have to avoid these phosphorus-rich foods in renal failure because in renal failure, the phosphate is retained. So we cannot add more, okay? And we have to encourage in refeeding syndrome or hypophosphatemia. And remember the relationship. When phosphate increases, calcium decreases, okay? So there are some few questions we are rounding up. I'll run through it and then we can finish up to help us understand all that we have studied. So this is hypokalemia from diuretic use. A client is taking furosemide for heart failure and complains of muscle cramps and weakness. ECG shows a flattened T wave. Which actions should the nurse take first? Notify the provider. If you know the answer, you can put in the chat box. We're running through, so I'll give the answers right away when I'm done. But if you know it, you can put it in the chat box. Notify the provider and expect a potassium replacement order. Encourage fluid intake to improve perfusion. Administer sodium chloride tablets as prescribed, and then assess for signs of fluid overload. Okay, I have some answers. I have A. Notify the provider. Yes. Notify the provider. So yes, furosemide loop diuretic will cause potassium loss, leading to hypokalemia, which affects cardiac rhythm. So that's why I had a flattened T waves that confirms hypokalemia. So you have to replace promptly. Good. Okay, so let's look at this. I want us to run through. Hyponatremia. A marathon runner collapses after drinking excessive water without electrolytes. And then they check the serum sodium is 120. So remember the reference range. So which finding will be most concerning? We are dealing with hyponatremia. Nausea and fatigue, dry mucous membranes, confusion and seizures, low urine output. So most concerning. Let's see. Okay, got a C. So that should be what? Yeah, that's C. Remember, that's a favorite for NCLEX. Severe hyponatremia causing cerebral edema, leading to confusion and seizures. That is NCLEX favorite. Okay, so let's look at the last question. I've already showed the answer, but let's run through. Oh, as a mother, when your baby is crying, then you have all of those stuff. Yeah, well, let's go on. Hypernatremia, dehydration. So, an elderly client with dementia has serum sodium 156. So remember the reference range. Then you ask yourself, is it low or high? Which nursing intervention is a priority? So when you think of the high sodium or low sodium, what will be the signs and symptoms? So what will be your intervention for that? Offer frequent sips of water or oral fluids, restrict sodium and fluids, encourage high protein foods, administer hypertonic saline. Let's go, let's go, let's go, let's go. I showed the answer already. It is A, it's A, it's A. Okay. Offer frequent sips of water or oral fluid. So water losses causes hypernatremia. So when we replace the fluids, so based on the level of the dehydration, we can either be oral or we give IV fluids, okay? So we can't restrict fluid. That will work. So I want to give you some final tips to go with. So know the normal ranges, okay? And then remember that you have to look out for like ECG changes for some of these electrolyte losses. Always remember that. And remember, potassium, you do not give that IV bolus. It doesn't, it should not be done. See the impact that potassium has on the heart. So never choose that option that you're going to give it bolus. And then we recheck the lab before we give the electrolyte. I want to be sure whether the client is really hypokalemic or hyperkalemic before you solve it. So when you are torn between what to do, when you're in doubt, you have to protect the heart, the brain, and then the airway. So remember the memory tricks that I gave you, that I will use 3.5 to 5 bananas to make banana bread. I will call 911 calcium, 9 to 11, and then magnifying glasses, 1.5 to 2.5 for magnesium, and then try and every time memorize for chloride, and then so remember the rhyme as well. Little Maggie, which is kind of difficult, but let's see who maybe may save somebody. Little Maggie, 1.3 to 2.1 years old, 3.5 to 5 bananas for potassium, drank 9 to 10.5 of milk, calcium, and took 135 to 145 minutes nap after swimming in the ocean. Interesting. So remember, calcium, potassium is for the heart, calcium for the nerves, magnesium, muscle, sodium, a lot of impact on the brain. So that client will have confusion, seizures, and then phosphate goes with calcium. They have opposite relationship. And remember, wherever sodium goes, water will fall also. And remember the food ingredients, because NCLEX loves it, that if a client is on loop diuretics, what should you do? Client with renal failure, what should you avoid? Client who has had thyroidectomy and has low calcium, what should you do? Client who's abusing alcohol, what should you do? SIADH with hyponatremia, what are you going to do? Restrict fluids and salt, and then dehydration. Has the class been helpful? Any questions? We are here, we are done. Great, great. I hope it's been helpful to you. Do well to revise and every day try and remember it, write down the values like from memory, and then it will become part of you. Because when you are attending, these are not just figures, you are attending to the clients and it's hyperkalemia, and you are able to spot it right away and then help save the client. So it's not just about numbers. This is like somebody's life at stake. Thanks for the feedback, Mommy. So yes, we thank God for a beautiful session today. Join us at MedCognito. Why haven't you enrolled in our program? Why haven't you invested in any of our programs? Because we want to be a part of your journey to help you master the content, then give you the strategy to be able to put all the content together and then work on your mindset and walk into the exam hall with boldness and courage to go ace the exam. So join us.